All right, welcome again, everyone. My name is Caitlin Minch, and I am the recruitment advisor for the University of Maryland School of Public Health. So great to be here with you tonight for our virtual question and answer Q&A session tonight. Hopefully, we'll be able to answer your questions about the School of Public Health and share a little bit more information with you. I'm doubly excited to be here because I'm also an alum of the University of Maryland. You can see a picture of myself and my husband here in our freshman year. So I always enjoy sharing everything that's so special about the University of Maryland with prospective students. With me tonight is also my colleague, Taylor Sanders, who is a senior academic advisor in the School of Public Health, and she's helping me with a number of different Zoom things and keeping an eye on the chat. We also have some wonderful students, staff, and faculty here that you'll get to hear from. So tonight we're going to go over a little bit of information first. We'll have an introduction and a welcome from our Assistant Dean for Undergraduate Education. We'll go over some aspects of public health and public health at the University of Maryland. We'll review our 4 undergraduate majors, and then we'll get into the meat with the question and answer session. So if at any point you have a question, either for myself or some of our panelists, you are welcome to drop it in the chat. We'll keep an eye on that, and we'll either answer your question live or in the chat, depending on what it is. And then for your viewing, you may want to switch your screen into speaker view. You can do that by clicking view at the top of the screen and selecting speaker view. That way you can always keep the person who's speaking in frame. All right, so without further ado, I'd like to introduce my wonderful colleague, Dr. Nicole Cousin-Gossett, who is the Assistant Dean for Undergraduate Education in the School of Public Health, to give us a welcome. All right, and she just will need to unmute.
I appreciate you. Thank you so much, Caitlin, and thank you for the reminder to unmute. And oh, that picture of you freshman year with your husband, that is priceless.
Thank you.
Absolutely priceless and such a great memory, I'm sure. And to have a photo of that is just so awesome as young Terps, if you will. Well, welcome everyone this evening. I will be very, very brief. We want to spend this time giving you the opportunity to have your questions answered and really help you through this process. It is a difficult decision, deciding where to commit, where to go to school, and we're here to assist you in that process this evening. As Caitlin said, my name is Dr. Nicole Cousin-Gossett. It is my pleasure to serve as the Assistant Dean for Undergraduate Education here in the School of Public Health. Here in the School of Public Health, as Caitlin mentioned as well, we have 4 majors: family science, community health, kinesiology, and public health science, all of which have amazing curriculums, amazing faculty, and last but not least, staff supporting our students through their undergraduate education. There's approximately 2,500 students across our majors. So as for Maryland standards, we are small, but we are indeed beautiful. And you're going to hear about some of that this evening. Part of our mission is to prepare the next generation of public health professionals. So here in the school, we emphasize competency in a lot of different areas. So mental health, for example. So I see that Dr. Kevin Roy is on tonight, who is coming from the Department of Family Science. And he might just share with you, I'm sure he probably will, some of the exciting things happening in the Family Science Department around mental health and truly responding to what not only the needs are in the field, but what students have shared in terms of wanting to get more training and understanding of mental health and how it impacts everyone. They're doing some really awesome things, baking mental health into the curriculum in the Family Science Department. So really excited about the growth that's happening there. Other areas where we emphasize competency in health literacy, physical education, health equity, which is huge, family and child health, climate change and health, and other areas as well. So there's a lot of things that are very current, very important going on here in the school. So like I said, selecting a school is, well, quite frankly, it can be quite daunting. I have a college freshman. So my oldest child is a freshman in college. So we were here this time last year, and there were more questions than answers, we often felt like, in trying to make that decision. Well, we're here to address those questions and to be a point of contact as well. So there's tonight, but beyond tonight, you've got a bunch of people here that are on this call that are also great points of contact if a question occurs to you that you didn't get to ask tonight. So welcome, welcome, welcome. This is an opportunity. Please take full advantage of it. We are here to provide as best as we can those answers for you. And Caitlin, I'll hand it back to you.
Yes, thank you so much. I appreciate you being here this evening. All right, well, let's get back to what exactly is public health to make sure we're all on the same page here. Public health is a very broad field that today I'm sure most of you know us as being on the forefront of the COVID-19 pandemic, but there's a lot else that goes into public health. Public health is a field that focuses on promoting health, preventing disease, and prolonging active, high-quality lives. To give you a comparison, the field of medicine typically focuses on treating disease and illness, whereas public health will focus on preventing disease and illness. And so public health is all around us in things like vaccines, no smoking campaigns, promoting healthy fruits, vegetables, healthy diet, exercise, family therapy, looking at the effects of air pollution on health. All of those things are public health. And so in our public health programs here at the University of Maryland, students are going to study topics like mental health, health literacy, family and child health, climate change and health, physical activity, health equity, and healthcare access. All of these things are part of public health. So if any of that sounds interesting to you, you are in the right place, and we're so excited to help you learn more. So to give you a few more examples of public health in action at the University of Maryland, here are a few of our recent headlines coming out of the School of Public Health. For example, exercise intervention in older adults improved brain function related to memory. A new project aims to reduce tobacco use among Maryland's LGBTQ community. Doulas are associated with better maternal health care, especially for mothers of color, and the impact of parental environmental exposures on adverse birth outcomes. So if any of that research sounds interesting to you, again, you're in the right spot. All right, just a few statistics that Dr. Cousin-Gossett started getting into. We are a medium-sized school here at the University of Maryland with a little over 2,300 undergraduate students and around 400 graduate students. We are very proud that our school is the #1 most racially and ethnically diverse college at University of Maryland, with around 50% students of color. We have students from 24 different countries of origin and 36 different states, DC and Puerto Rico, represented in our students. And around 25% of our undergraduate students are first-generation college students. So no matter who you are, there is a place here for you at public health at the University of Maryland. And these are our 4 majors. We offer 4 interdisciplinary undergraduate Bachelor of Science degrees. Our first is community health, where students study community-based interventions for advancing public health. The second is family science, where students study the family unit and how family relationships impact health. The third is kinesiology, where you study the movement of the human body and physical activity. And the fourth is public health science, where students study public health through a life science lens. So to give us a little bit more information about these majors and the student experience, we have a short video from some of our current students, some of our former students, to tell you more. Sorry, let me reshare so I can get the sound right.
We are
Generation Public Health. My name is Hillary Lamb, and I'm studying Public Health Science and Finance. Public Health Science is such an amazing major because it's so flexible and you get to explore so many different paths that relate to your career.
Hi, my name is Sarah Hatfield, and I'm a behavioral and community health major. I chose to major in behavioral and community health because I always knew that I was interested in a career in helping people. One thing I've learned in the Department of Behavioral and Community Health is that health encompasses so many aspects of our lives. Health isn't just the absence of disease, it's complete mental, physical, and social well-being.
My name is Brina Bett, and I'm a family science major.
I think that you should choose family science because it's a major that allows you to build cultural competency skills, learn more about working with others, and practice empathy and leadership skills as well.
My name is Phoebe Gornialan, and I'm a kinesiology major. As a part of the Kinesiology Honors Program, I have the opportunity to complete research at the university under the direction of a faculty member, and I'm really interested in looking at osteoarthritis or possibly exercise science.
During my freshman and sophomore year at the University of Maryland, I was a part of the Global Public Health Scholars Program. There, I was introduced to one of my greatest experiences at the University of Maryland, which is Public Health Beyond Borders. Public Health Beyond Borders seeks to reduce health disparities and empower children and families, both locally and globally, to achieve their best health.
I'm Brendan Jones, and I am a public health science major. I really want, as far as a career, to help with access and equity. I want to help underserved populations get the help and the care that they need. So whether it's migrant families, whether it's African American mothers and or men, between the ages of 45 and 65, I really want to help them understand their rights and that they are entitled to receiving the best health and the best possible outcome that they can.
What we're looking for here at the University of Maryland are students who are ready to become game changers, who are going to be those elements of change to make our society better in the future. Not only is public health in the news because of everything going on, but it is a great career path. We're here to create the next generation of public health leaders.
In the School of Public Health, we have such a close-knit faculty who are readily available to help students, whether that be finding and narrowing down a career path, helping connect them to internships and research experiences, or helping them in coursework and finding clubs to get them more connected to their campus community.
Campus is giant, but within public health, you find so many people who are actually inviting, actually warm, and really seem to enjoy what they do. So it's really easy to develop like a kinship and friendships with them.
We are Generation Public Health.
We are Public Health Terps. Join us in fearlessly promoting health for all.
All right, hopefully that gave you a good idea of what we're all about. All right, and to continue the conversation, we have our wonderful panelists here this evening. So I'll ask all of our panelists to turn their cameras on. We have a group of students here, we have a couple of faculty members, and we have a couple of advisors. So they are here to answer your questions. So again, whether you have questions for myself or for one of the panelists, please don't hesitate to drop it in the chat. I have some questions to get us started, so we'll start with those. But again, don't hesitate to ask your own questions in the chat. All right, so I am going to ask, one second here. I am going to ask that everybody introduces themselves. So I'll start with our students. If you could introduce yourself with your name, your major, your year, and where you are from. We'll start with Sarah.
Hi, my name is Sarah. I'm a senior at Maryland. I'm a behavioral and community health major with finance as well. And I'm actually from Ellicott City, Maryland as well.
All right, Dory.
Hi, excuse me. Hi, I'm Dory. I'm a junior kinesiology major, and I'm originally from Calvert County, but I moved to Upper Marlboro in Prince George's County like 2 years ago. So
Awesome, welcome. All right, Verity.
Hi everyone, I'm Verity. I'm a senior. I'm studying public health science and then double minoring in sustainability and global poverty, and I'm on the nursing track. I was born in England, but I've lived in Maryland for several years now, so technically I'm US citizen too, so fun time.
Yes, awesome. And Phoebe?
Hi, my name's Phoebe. I'm a senior kinesiology major, and I'm from Northern Baltimore County.
All right, welcome to our students. Well, I'll ask our staff and faculty to introduce themselves next with their name, their title, their department, and their role. So I'll go ahead with you, Professor Kennedy.
Hi, everybody. I'm Tracy Kennedy. I am in behavior and community health, and I run the internship program for the community health majors who do a full semester internship during their last semester.
Yes, awesome. Professor Roy?
Good evening, everybody. I'm Kevin Roy. I'm a professor in the Department of Family Science. I've been at Maryland for 18 years, and I've worked primarily as an undergraduate coordinator with the undergrad committee, but also the graduate coordinator as well. So very happy to see everyone here and look forward to discussion tonight.
Thanks. Advisor Taylor?
Hi, everyone. My name is Taylor Sanders. I am an academic advisor in our Center for Academic Success and Achievement, which is our college level advising office. So I work with students across all 4 of our majors. I specifically work with our orientation program. So if you do end up coming to Maryland, I will see you at orientation.
Thank you. And Advisor Kayla? Oops, you didn't unmute.
Sorry about that. Hi, everyone. My name is Kayla Packer. I am an advisor in the public health science program, and I mainly work with students that are incoming and prospective. So just starting out at Maryland, or just, thinking of that transition if you're already here, changing majors potentially. So excited to answer any questions you have tonight.
Yeah, and I also want to recognize that we have one of our brand new advisors on with us as well, Advisor Larry from Behavioral and Community Health.
Thanks, Caitlin. Yes, my name is Larry Hoffman. I'm the advisor for Behavior and Community Health, and it's great to be here tonight. Hopefully we can answer some questions for you.
Thank you. All right, so students, I'll come to you first. So can you tell us, why did you choose the University of Maryland, and how did you choose your major? All right, so Sarah, we can go in the same order again.
So I'm from Maryland, so Maryland was kind of like a lot of the goals of like where people want to go for school. And I honestly really love it. It's a big school, and I was looking for that kind of environment, and it is at the forefront of like a lot of research and a lot of opportunities to get involved. And then it just has so many like organizations to be a part of and to really make your entire like experience in college very worthwhile. I chose my major. I was originally a business major. I originally wanted to go into healthcare when I was in high school. Realized that like being on like a primary care front was not necessarily like meant for me. So I went into business, but I still was really interested in like what healthcare had to offer. So then I added on behavioral and community health as a double major.
Awesome, thank you. What about you, Dory?
It was why I chose Kines.
Yeah, why you chose University of Maryland and how you chose your major.
Okay, so I chose University of Maryland. It really came down to the diversity for me. That was a huge, huge indicator of where I wanted to spend the next 4 years of my life. Most of the schools that I applied to did not have that criteria, and one thing University of Maryland really does pride itself on is diversity. I'm walking around and I see people who look like me, people who don't look like me, and I think that's really important. I'm able to immerse myself in not only my own culture, but learn about others, and I think that's really important. Because college is the space in life where you learn to integrate in the world, and not just sticking with your own, what you know. And I think that's a really big thing. As far as kinesiology, ever since high school, I've always really been interested in the body, the mechanics of how we move, how everything works in that regard. And I think as someone who has played a lot of sports, who has been injured a lot, I really wanted to learn from a different perspective of basically like how the body works. And I was really interested in anatomy from the University of Maryland. And I think kinesiology is a great path to not only sticking with the pure anatomy of the body, but actually like the mechanics of it, the history of the body, like all the different perspectives involved from a psychological standpoint. And I think it's just a really great, well-rounded major.
Awesome, thank you. What about you, Verity?
So I went to all girls school. There was 49 people in my year for 7 years. And I was really looking for a school that was big, like Dory said, had the diversity, had like a wide range of classes that I could really explore and find kind of my place. And that's exactly what Maryland had. I came in undecided. I thought I wanted to do theater. I thought I wanted to do like art or also environment. But having such a big school, you have the opportunity to take all those classes and really find your passion. So end of sophomore year, which gives you so much time, I found my love for public health science. And I really love public health science because you take health policy classes, you also take environmental classes as well. So it's really holistic education, and you can find your real passions during it.
Awesome. Thank you. And what about you, Phoebe?
So I originally came in as a biology major, and I was also invited into the scholars program, and I was a global public health scholars. I was in that program. And so from there, I realized that I wanted to focus more on public health and the public health aspect. And so what drew me to kinesiology was me taking a kinesiology course and just absolutely loving it, and just being introduced to that knowledge and that education. Like I really looked forward to that class a lot. And so I transferred into the School of Public Health and declared as a kinesiology major. And just kind of touching briefly on the question in the chat, I initially wanted to go into physical therapy, but now I am looking more towards being a physician assistant with a specialty in orthopedics, which is where the kinesiology side of it kind of lines up.
Okay, awesome.
And then,
awesome.
Before we move on to faculty, I wanted to just ask Dory really quick if she could answer the question in the chat about your career path. Dory, if you could share a little bit about that, what you're interested in career-wise.
Yeah, so after I get my degree in kinesiology, I have plans to attend medical school and eventually become a sports medicine physician for some sort of sports team. Right now, my dream is football with the NFL, but let's work up to that. And I might even want to get to a point where I open my own clinic for orthopedics in underdeveloped communities, specifically addressing minority health.
Awesome, thank you. And I actually see a kind of related question that came through in the chat also. Is there any way I could major in economics and minor in public health? And is the School of Public Health an LEP? So the School of Public Health only offers majors. We do not have any minors. However, it is very possible to double major. And in fact, Sarah is doing just that. So Sarah, do you mind sharing a little bit more about how you're double majoring?
Yeah, of course. So I'm a finance major as well as a behavioral and community health major. Eventually, I want to go into and work where business and healthcare ultimately intersect. So like healthcare consultant, healthcare administration. It's definitely possible to combine your majors and do both. It would need a little bit of flexibility on your part, like with your schedule and communication with both advisors from both of the different schools to make sure that you hit all of your requirements. And communication with an advisor is the number one thing I would recommend, especially if you're going to double major in a school that's not in the same school. I think it's very worthwhile. I think especially since you get very exposed to two different types of groups of people, and so you can really see how maybe economics and public health can ultimately intersect as well. So it's definitely possible. It might be a little more like a Tetris game of when can I take what classes, but you can definitely do it, and I would even recommend it just because of how exposed and across school I am.
Thank you. And then the second question was, is the School of Public Health an LEP? And at the University of Maryland, LEP stands for Limited Enrollment Program, meaning to get into one of those majors, you have to not only get into the university, but you have to also get into the major. And there's another set of criteria for that. None of our majors in the School of Public Health are a limited enrollment program, meaning if you get admitted to the University of Maryland, you could get admitted to our majors. So there's no additional criteria or anything like that, which I think is definitely a perk that we are open to everyone. All right, so students, I'll come back to you with another question. And students who are attending, feel free to keep putting questions in the chat as you get them. So for the students, what has been your favorite public health class? So favorite class you've either taken in your major or something related to public health. Sarah, we'll come back to you.
I really enjoyed the class where we basically ran a social media campaign and we got to see how health literacy is such an important skill and put it into use and being able to communicate with like people that might not have this in their regular dictionary like usage, and being able to convey a public health idea to the mass. I forget the exact class number, but it was really interesting. I think it was like social media, public health social media campaign. I forget what it is. If I remember in the next like couple minutes, I will definitely put it in the chat. But it was a really awesome course where we put a lot of what we learned into practice. And I think that's also a skill that you find in a lot of like the public health classes is that like you learn something and then you also put it into practice.
Awesome, thank you. What about you, Dory? What is your favorite class been so far?
I think one of my favorites was definitely Families and Global Health. And this was taught by Dr. Elizabeth Maring. She's excellent. She's great. If you ever have the opportunity to take a class with her, I absolutely would. And that kind of secured for me that, oh, wow, I'm actually in the School of Public Health. There's so much more to what my understanding of medicine was than just like the hard science of it. And really, once you enter that realm of global public health, it's really hard to stop because there are so many problems in just our world that we have the power to address. And yeah, that's a really powerful thing. And once you're equipped with that knowledge, you really have the power to take it into your own hands. Yeah, I would say my favorite Kines class was probably the history of sport in America or sports psychology.
Awesome, thank you. Verity, what about you?
So the great thing about our major is that kind of when you get to junior, senior year, you can have these option classes, which you really encourage you to either like get an internship, study abroad, very kind of niche to your passions. So I'm in the Global Fellows program, and that's a seminar in the fall, and then you get an internship in the spring. So I'm in water security and global health challenges, and it's a lot of like debates back and forth, like group collaboration, and my professors actually work specifically like within the government, so they're very knowledgeable, very just chill people, just hearing their stories, so I really love just the collaborative part of the class.
That's awesome. Phoebe, what about you? Your favorite class so far?
So I will definitely echo Dory. I absolutely love Dr. Maring. She taught SPHL 260. I'm not sure it's being offered currently, but similar to Dr. Maring's other class, like you look at a lot of issues that are going on, and you actually get to create your own intervention for certain topics that you choose. And it was just really cool to think of it in a like hypothetical sense and just like create an intervention for something that's really real. And I also enjoyed Kines 350, which is sports psychology, as well as the current class I'm taking, which is about palpation of muscles and manual muscle testing.
Awesome. Well, we've got a couple of questions in the chat. One of them is there a learning community at Maryland associated with the School of Public Health or any of the 4 majors within it? So at the University of Maryland, the living learning programs are kind of separate from major in a lot of ways. If you're offered admission to one of those living learning programs, it's done when you get offered admission to the university. And a lot of them, like I said, are very flexible on what major you are. There is one that is kind of more so tied directly into public health, the Global Public Health Scholars Program, which Phoebe, I know you were a part of. I'm not sure, I don't think anybody else mentioned that they were a part of it. Do you mind, Phoebe, just talking briefly about what that program is?
Yes, so it's a 2-year program. For your freshman year, you're doing a lot of like learning about global public health itself. and you do a lot of like the intervention work I was talking about. Dr. Maring is one of the faculty who runs the entire program. And your second year, you focus a lot on your practicum project, which is where you go out into the real world. You either get an internship, you do some research, or you can study abroad. There's a lot of things that can fulfill your practicum project, but it's really taking and applying a lot of what you learned in the classroom during the first year and like the half of the second year, and just applying it to the real world.
Yes, thank you. And I see the question in the chat about for a public health science major, will I still have the opportunity to take a good amount of lab sciences as well as more applied sciences? Thank you for answering, Dory. She said that yes, everyone has to complete a set of general education requirements along with major requirements. And the public health science major itself has many science courses itself required to finish the major. And so our advisor, Kayla, will talk about, you can talk about that in a moment as well. But I'd like to switch over to our faculty briefly here. I'd like for them to each tell us about your department and the undergraduate major associated with your department so we can get to know your majors a little bit better. Professor Kennedy, why don't you start?
Oh, great. Yeah, start with me. Okay, so our degree is actually called Community Health. So our department is Behavioral and Community Health, but you will be getting your Bachelor of Science in Community Health. And we have, a lot of exciting courses. We're changing them all the time, adding new electives and exciting courses to our major. I think the thing that may set us apart a little bit is that we have that culminating full-time capstone internship at the end of your program. So your senior year, your second semester senior year, the last thing that you're going to do is you're going to be working in the field full-time. It is a 12-credit course that's associated with that, but you will get an internship working in a health department or state or local or federal government. You may work at Maryland General Assembly in Annapolis, a hospital, depending on where you want to go. If you want to go into research, there are a lot of organizations that we can plug you in for doing research, nonprofits, things like that. So I think that is kind of like the feather in our cap, or what have you. A lot of our students go on to either be employed by their internship site, but it definitely connects them, helps them network to landing a great job or landing a great position in grad school. We have a couple of other things, like you can do a specialization. So we currently have 3 specializations. You can do special populations, you can do risk behavior or health communication. We also have the whole School of Public Health has the opportunity to participate in the BS MPH program or apply to that, where you can spend your 5th year completing your MPH, but you could major in any one of these undergraduate majors and then do your MPH in a different department. So that's kind of cool. We have a mentoring program where you will have a faculty mentor. Everyone coming into the degree, they're assigned a mentor. So you'll have, it'll kind of bring it down much smaller. So you, in addition to the advisor and your professors, you'll also have another faculty member who serves as your mentor. We have the honors program, which is a 2-year program. You apply for that at the end of your sophomore year, where you can study one-on-one with a faculty member. You can write a thesis or do a project right before going into your internship semester. So that's really kind of cool. So again, like broadening your world and networking. So maybe you're going to do your internship is that final semester, but prior to that, you're doing your thesis or your project at a nonprofit. So you're getting hooked up with 2 different organizations, where it's expanding your experience and your skills and experience and all of that. Anything else, Larry? I'll put him on the spot. So Larry's been here a total of a week. So we're really excited to have him. But a lot of exciting things going on. I've been in this department for 10 years now. We really and a lot of the majors in School of Public Health, you'll find this no matter what you major in, we operate as a big family. And I think we have a really close department. We're really close with our students. And then one final thing I'll say is we are expanding our internship globally. So we've had interns in Kenya, in Tanzania, Guatemala. So we're always trying to expand that portion as well. So that's kind of an exciting thing. If you want to go abroad, we can work with you on doing your internship abroad as well. So that's, that's us.
Yeah, thank you. Professor Roy, can you tell us more about family science?
Absolutely. Like Tracy mentioned, I think we are a big school that works really well together. I think that what you'll find on campus is that we probably have more of a mission for social change and social justice than most other schools or colleges on campus. This is the place to come, and it's really an applied focus. So it's kind of a real world thing. If you have this commitment, it's not just about reading a book and thinking about, great thoughts. It's that too, but it's also, what do we do about this? What do we do in the real world? So family science is, along with kinesiology, two legacy departments that are non-traditional in any school of public health. You're not going to find many kinesiology and family science programs. We were the first family science program in the nation in an accredited school of public health, which meant we are marrying kind of all the notions of kind of psychology and sociology dealing with family policy and family close relationships with the public health focus on maternal and child health. So there's a whole field of maternal and child health that is very much based in epidemiology, but also social work, where you're looking at, the impact of health outcomes for mothers and kids, and increasingly family members. And in my case, I work with fathers. I'm a fatherhood scholar. So we kind of bring those together, and we're looking at the best of social science and public health brought together in an applied way. And what that looks like for the undergrad program is a focus on, for example, reproductive health. So there are not many places on campus you can go if you're interested in reproductive health and work with an epidemiologist who has been studying issues around reproductive health for 20 years, both professionally and coming into the school. We have folks who are appearing before the Supreme Court looking at the effect of abortion on mental health and how important that is right now, particularly with Supreme Court's decisions. We also have a working clinic in our program, and in the school we see over 400 families a year from Prince George's County, because we have a master's program that trains students to get clinical licensure to become therapists. So that's a big piece of what we do, is this mental health focus that Nicole mentioned. We think that we're the place to go on campus to study mental health, not just kind of in a laboratory setting, but in the real world with real families, sitting down with couples, working with them. We have an exciting program we just got funded called CLIMB, which stands for Campus and Community Leaders in Mental Health. And what we're doing is we're offering hands-on training beyond the classroom. So we have a core set of courses that require you to take mental health and healing, family violence, family crisis. But on top of that, now we're offering resources to have all of our majors trained in mental health first aid, psychological first aid related to family crises. We have a racial trauma book group that we're starting. We have kind of professional mentoring towards like a mental health career and all the different options and pathways you can take. So that's really exciting. We have a lot of our faculty who are trained as clinicians. We also have a long history of working with very diverse families and communities. That's what we do. We've been dealing with issues of inequality and poverty, policy interventions, program interventions with children and families over the life course. And we've been doing that for a number of decades in family science. And so, like Tracy mentioned, we have an internship program. We also have an honors program, and lots of undergrads work with us on our research. We have a whole team right now, for example, working on an intervention with undocumented youth from the Northern Triangle, from Guatemala, Honduras, and El Salvador. We're coming to the DMV because that's kind of the gateway for that community here in the country. Actually, they have three or four times the rate of trauma for young people who are born in the United States have, because of that migration journey. And so we're doing interventions in schools with them, evaluating those programs, working with communities to actually make a difference. And this is in Montgomery County, of all places. Oftentimes we wouldn't expect that in Montgomery County, but so that's the real exciting kind of hands-on piece that we bring. And so I think we're a really nice complement as a number of the students have said, we're able to take courses kind of across all of these different departments and put them together in interesting ways. So Dr. Mering, for example, is in family science. And so the global health piece is something that's a part of our curriculum as well. But we have majors all over the school being able to take those courses. So very exciting stuff.
Thank you. All of between you all and the students, you're making me want to go back to school too. Maybe this will be my second career. Well, we'll turn to the advisors now to get a little perspective from them too. So advisors, I'm going to ask you, what services do advisors provide to students? So Taylor, we'll start with you.
Sure. I can definitely start. I would start at as early as orientation. We as advisors are working with students there to help them register for classes. So we are kind of that first point of contact to help you get your foot in the door and get those classes on your schedule for fall. If we're looking at the timeline, if you think about registering for future semesters, we are there as advisors to help you pick those classes. But we do so much more than just advise on what classes to take. I don't want to like take up everyone's responses, but I definitely advise students on how to navigate difficulties within the classroom. So maybe this is their first time, of course, if they're a freshman, working with faculty, helping them formulate even something like formulate emails to their faculty or how to navigate issues in the classroom. Sometimes being CASA, so we are the home base, we like to call ourselves the home base. We will answer a lot of general questions. So maybe you're a student that doesn't know where to get a specific question answered on campus. We can kind of triage for you and help you identify what campus resources you need to access. So we are often a one-stop shop to get those general questions answered. Referring you to tutoring services, financial aid, other resources across campus to start.
Right, to start. There's a lot more going on too. Kayla, what about you?
Yeah, Taylor did a great job hitting on a lot of the points that advisors kind of help with. Again, I will echo that advisors really do serve as the first point of contact for students when they're on campus, or, whether it's, how do I utilize a resource, or is there a resource on campus that I'm not aware of? Students will come in with kind of any sort of questions, and we try to do a good job of triaging that, like Taylor said. But yeah.
And Kayla, I'll ask you, how often should students meet with an advisor?
So recommended to meet with their advisor at least once a semester, especially near those registration times, just to ensure, you're on track with your graduation requirements. There's other times you might want to meet with an advisor, like if you might not have performed well on a test and you're unsure of, what it will look like moving forward. Should I continue in this course? Should I withdraw from this course? Answering questions like that. What does that, mean financially? So pointers there as well. Maybe you have, something set up. Your plan is set up, but you've just learned about a new study abroad program. So how can I fit that in and still graduate in the same time frame? Questions like that. But at least once a semester, definitely close to registration time.
Perfect. Yes, I always say early and often too, right?
Yes.
Like
Yes.
the sooner the better.
Yes, definitely.
All right. Well, and I'll jump back over to our students now, so we can hear a little bit more about what else you've got going on besides just your classes. So students, what activities do you participate in outside of the classroom? So that can be anything, clubs, organizations, internships, research, study abroad, anything that you do besides class. Sarah, how about you?
So I really made it a goal of mine to stay really involved on campus. I've been involved with the Vietnamese Student Association. I held e-board positions for that. I was the Smith Undergrad Student Association's VP of Finance for a year. I was a part of Big Camp on their finance and sponsorship team. I've been an intern for this company for their business performance management called SCNH Group. I'm a CASA peer leader right now, so I get to see all the lovely advisors every couple days a week. And that's mostly what I've been doing. I wish that I studied abroad, but I wasn't able to give it to have the chance to do it.
All right, Dory, what about you? What are you involved in outside of class?
So I am a part of KSO, which is Kinesiology Student Organization. That's an example of a great student-led organization, and basically revolved around your major, where most of the time we just spent like talking to each other, asking each other questions. I don't think this year we've had any general body meetings yet, but I'm also part of, I think something was mentioned about public health beyond borders. That's also a really, really great way to really take the major to the next level with the immersive part of it, with the hands-on part of it. We've had a lot of really great things done through Public Health Beyond Borders. And I'm also a member of the Charles Drew Pre-Health Society, which is basically minorities getting together, talking about their aspirations toward working in the health field. So yeah, I think those are the three main organizations that I spend time with outside of class.
Thank you. Verity, what about you?
Yeah, so I definitely feel like I learn the best outside the classroom, and there's amazing ways to get involved. I'm in a CHAMP lab, which is a cancer screening and education lab. So we go to Baltimore and kind of lead workshops with the communities. Like I said, I'm in the Global Fellows program, so I'm going to have an internship in the hospital next semester. I'm going to India this winter to study public health abroad. So like kind of look at the clinicals. I think I might get to ride an elephant. I don't know. I saw that on there, so I'm getting excited. Don't like encourage myself too much. But then I'm in a service fraternity. I work at the visitors center. I TA'd for the freshman orientation class for a year. So there's great opportunities. I wish I could do more.
Never enough time in the day, right? Phoebe, what about you?
So one of my main jobs on campus, I work for the intramural sports program. Through there, I officiate. I also am one of the program assistants, meaning I just help schedule sports and just everything in general. I'm also on the student employee advisory board for RecWell, which is University Recreation and Wellness, which intramural sports falls under, and that's just basically to voice concerns within RecWell and also improve upon things that are already in RecWell. I'm also in Phi Alpha Upsilon, which is an honorary society for the School of Public Health. I have held 2 internships, one with a physical therapy clinic nearby in Bowie, as well as Greenbelt Cares, where I served as like a tutor for ESOL, which is English for speakers of other languages, as well as just like for students in general. I also have served as a teaching assistant for UNIV 100. I was actually Taylor's TA, as well as a teaching assistant currently for a sports psychology class. And also I work in a lab within the kinesiology department.
Yes, I love hearing about how busy everyone is. I'm always so impressed. Well, we heard a little bit from Dory and Phoebe about their career goals. So I'll circle back to Sarah and Verity. What are your current career goals right now?
So right now, I've taken a position for next year to be a financial systems consultant. I really want to dive into what consulting is and like get experience in that field. Eventually, my goal is to go back into like where business and healthcare meet ultimately. And I do want to get my master's in public health, a master's in health administration, or even like a master's of business with a healthcare focus, which do exist. And eventually go into healthcare consulting or healthcare administration, or just like very much business and healthcare.
Awesome, thank you. And what about you, Verity?
Yeah, so I'm currently applying to nursing schools. I'm looking for a 2-year kind of accelerated track to get my master's as a nurse. It's a certified nurse leadership, so I'll focus on equity, kind of going beyond just bedside care and looking at assessing the healthcare system and doing some reform. So cross my fingers, got 2 more to send in, but I'll hear back soon.
Awesome. Yes, good luck with those applications. All right. Well, again, students, if you're attending, if you have more questions, feel free to drop them in the chat. But right now I'll turn back to our faculty again. What is your favorite course to teach and why? Professor Kennedy?
Well, Health 491 is the only course that I teach. So Health 491 is the 12 credit internship course, which I love teaching. I love seeing students through this, final step in their professional development. I love maintaining the partnerships in the community with our preceptors. We do have a part-time internship that we developed, which is Health 399. So it's kind of just getting your feet wet a little bit with a part-time internship. So that is kind of a mini Health 491. And of course I teach UNIV 100. So, that's a good time with a freshman. So maybe I'll, meet some of you in that UNIV 100. But Health 491 is really where my heart lies with, shepherding the students through their internship. So it's just amazing to see how much students grow from that first nervous, first step into their internship to running programs at the end and really making changes at their internship sites and bringing in new perspectives. And the preceptors are always kind of blown away by the students from the School of Public Health, no matter what major, because we do share some some internship sites. So it's just really cool just to see that growth over 4 short months. So I love teaching Health 491.
Absolutely. And Professor Roy, what's your favorite course to teach?
Oh, I have my go-to. So I've worked for so many years to build a course like this, and I'm very excited. So for the past 5 years, I've been teaching FMSC 190, which is an I-Series course, which all freshmen and sophomores, everyone's required to take a number of I-Series courses. And these are kind of innovative, cutting-edge topics that we really want, particularly freshmen and sophomores, to take. The course I teach is called Man Up. It's about masculinity, toxic masculinity, and mental health, public health, all types of health outcomes. It's really the way that masculinity impacts women and children's health as well as men themselves. So we look at a whole range of different things. We look at racial and ethnic contexts for masculinity, very important. We look at men's expression of emotion and violence and trauma that we're dealing with constantly when we think about toxic masculinity. We look at issues of mental health, but physical health. Today we had a guest speaker who's a urologist. We talked about contraception, vasectomies, testosterone treatments for men, which are things that we all have questions about or misperceptions or myths about, and the students got really involved in writing questions and asking about that. Incorporated in that course is a lot on fathering. So I have all students interview their father or a father figure and talk to them about their fathering experience, which is probably the most unique part of the course and the most moving for sure. I'm just, the things that come out of that one simple assignment are profound. We do a health literacy project. So we have groups working on issues around prostate cancer and smoking or substance abuse or police brutality or consensual relationships. A whole range of topics that impact men's health, and they do students do poster presentations or virtual presentations on that. So it's great. It's a very popular course. I offer it in the fall and the spring, but also in the winter and the summer online. So, and we are never have an empty seat. So it's a lot of fun, and students tend to be really interested in it. So that keeps me excited. So.
Yes, hopefully you'll get some students interested in both of these courses and,
that would be awesome.
ready to take them. Well, my final question for you faculty members is why should students build relationships with their professors, and how would you encourage students to do this? So Professor Kennedy.
Why and how? Was that the question? Okay, so why is letters of recommendation. But actually, I'm just kidding. It really just enhances your experience. It makes this large university and this large school really come down, brings it down to a personal level. It's, developing relationships with your professors. Your grades are going to be better because you have someone you can go to that can, work with you if you're struggling with a content. It can make all the difference if you have personal issues that you need someone to talk to about. And it can also help with your networking. So, you want a job in a research lab. You can, go to one of your professors. They are all connected. They all know each other. They're aware of, positions that are open. And so it's a really great way to find other opportunities. And then how, of course, is to speak up, attend office hours. Students are really afraid to do that, but that's why, like in UNIV 100, that's actually an assignment. You have to go to office hours to kind of break down that barrier to, to break the ice or whatever around that. And, professors are human, and you learn that through that interaction, and then they learn that you're actually interested in the content. So I think it just, it changes the way that you are viewed and the way you view your courses and the content. So I think it really makes all the difference.
Absolutely. And Professor Roy, anything to add on to that?
Yeah, I'm going to echo everything that Tracy said. I feel like public health is known for having fantastic counselors and advisors, fantastic faculty. They're approachable. We are not massive programs where you never get to see a faculty and all you're seeing is dozens of TAs lined up in sections. I mean, we're real people. We have nice size classes. And I agree with Tracy. The idea is grab me after class, knock on my door, see me in the hallway, tell me about your interests. I have two sons, both who've come through the University of Maryland, and both who are in engineering, which they tell me is the real science. But I say, no. What we do is really important in public health. But they've taken my course and they say, wow, it's so different. And you're so approachable and I can talk to you about what I'm thinking about. And so what I feel like is we are extremely invested, even the research faculty, those that are really doing research every day, we are very invested in your learning, in your development and growth. I mean, that's why we're here. That's why we're at a public university like this. That's why we're in a school of public health. And so when students come to me and say, I'm really interested in giving back to my community, or I want to make change, that's the golden ticket. I mean, to me, then I'm going to invest in you and where you want to be and how you meet you, getting you successful on your own terms. That's super important. So we're very approachable and very excited to work with undergraduates. That's part of the reason we're here. So
yeah, absolutely. Don't hesitate to come talk to us ever. We love to talk to students. All right, well, advisors, I have one final question for you as well. What is a common challenge that students face, and how do you recommend that students avoid it? So Kayla, I'll actually come to you first.
Yeah, I would say many students, especially those in the public health science major, are considering or are already on a pre-health track. So fitting in additional med school requirements can seem overwhelming at first, but it's definitely doable. But you want to make sure you talk to your advisor. You go to, pre-health advising on campus. And you kind of keep on track with what your requirements are for med school, in addition to the University of Maryland, making sure that you can kind of make the most of the time that you do have here. And then you can kind of see that there'll be some overlap if that's something you're interested in. So it's easy to feel overwhelmed, but at the end of the day, most things are doable. And sometimes it just takes talking to someone else about it.
Absolutely. Taylor, do you have anything you want to add about a common challenge and how students can avoid it?
Sure. Yeah. A common challenge that I see with the students that I work with is whether it's their first semester, it doesn't matter really when in their college experience. At times students will be struggling in courses, could be multiple courses, and they come to me, October, November, or maybe it's March, April, if we're in the spring, towards the end of the semester, and they are in a hole and they are like begging me to help them dig themselves out of it, which I can help. But at that point, it's often too late to try to make up a grade or bring up a grade at that point in the semester. And so my advice is to access resources early and often. So tutoring resources, using study sessions, forming study groups. These are all things that A plus A students do from the get-go. I think oftentimes we think of tutoring as being remedial or for students that are struggling, but really those resources are what can help you succeed from the beginning. So I would say access those academic resources early and not when it might be too late.
For sure, for sure. Again, another early and often item. Well, to close us out, students, I'm going to ask you to do a bit of a lightning round with me. The students who are on the Zoom with us, the attendees, are applying to schools, colleges right now, and considering where they want to go as the part of their next step. So what advice can you share with students in the college search process? So again, just a lightning round, some quick responses. Sarah?
I think stay open-minded. I was very surprised that I liked Maryland as much as I did. And now I can't imagine going anywhere else.
I would say if you're a Maryland native, if you wanted to go super far, don't think oh, I'm at Maryland, that's not impressive to go far. When you're on this campus, it's its own world. So yeah.
Yeah, and take advantage. I didn't join any clubs and stuff my freshman year, and I wish I had more time. And definitely being in DC, there's Annapolis, there's internship opportunities, there's Baltimore. My friends and I love to find really fun stuff to do, ice skating, cherry blossoms, so much to do. Take advantage.
Ditto to everyone. You'll find an amazing amount of opportunities here. If you're scared of finding something, you will find something that you enjoy, something that you're really passionate about.
Absolutely. Well, thank you so much to all of our panelists for these wonderful responses. Students, I hope you were getting your questions answered here. I know I really learned a couple of things this evening too. Well, I'm just going to share briefly our evaluation. So you can either scan the QR code on the screen or enter the link at the bottom of the screen or click on the link in the chat. We want to know how we did this evening. Let us know how you think the event went and if there's anything we can improve for next time. And then finally, this is my contact information. Again, my name is Caitlin Minch. I'm the recruitment advisor for the School of Public Health. You can email me futuresph@umd.edu. And if you want to reach either of the professors or advisors who are here on the panel tonight, I can also put you in contact with them as well. So again, thank you so much for joining us tonight. We hope to hear from you again soon, and go Terps.